Hello, my name is Kelsey Pelton. It is with great pride and excitement to present a summary of my capstone project for my Master of Science degree in Engineering, Sustainability, and Health. My capstone project is on environmental risks to public health and the disproportionate burden on vulnerable populations. To define the scope and parameters of my study, the methodology and processes I used was a multifaceted approach. One major factor that played a huge role in this study was exploring various ways of knowing or believing in a topic to enhance the validity and reliability of my research outcomes and engage with different perspectives. My capstone project consisted of in-depth research, analyzing literature, and exploring scientific findings and studies, analyzing data sets, conducting interviews with various professionals, and incorporating as much of my studies from the past 2 years that's relevant to my project into this capstone. Key questions as part of the project were: what are the health threats from exposure to air pollution, water pollution, and climate change? What populations are most vulnerable to environmental burdens and why? How did we get here? What is environmental justice and why is it important? And finally, what can be done? Exposure to polluted air causes risk for disease and health conditions such as lung diseases, as an example, lung cancer, asthma, pneumonia, an increase in respiratory infections, heart disease, strokes, and even premature death. Anyone living in places with poor air quality and failing grades for unhealthy levels of ozone or particle pollution are at severe risk of harm to their health. Drinking water with unsafe levels of contaminants can cause nervous system damage, reproductive damage, developmental issues, immune system dysfunction, cancer, kidney impairment, organ damage, as well as toxicity to the reproductive organ and spread of disease. According to a study done in the United States in 2023, data indicates that 854 systems supply drinking water contaminated with toxic forever chemicals known as PFAS to over 44 million people. As the climate changes, more people may be exposed to extreme weather like heat, floods, droughts, storms, and wildfires. These events can cause illness, injury, and even death. Health effects of climate change include cardiovascular and respiratory diseases, premature deaths, food and waterborne illnesses, and infections. Climate change can also lead to more disease spread by insects and ticks, and it can affect the quality of air, water, and food, including through the spread of harmful bacteria and viruses. Finally, hazards related to climate change can stress people's mental health. A key finding is that existing environmental burdens affect the most vulnerable people much more than the general population. The most vulnerable populations to developing health conditions from environmental stressors are children, elderly people, people with pre-existing health conditions, lower income, and minority populations. As part of this project, I uncovered the many scientific, behavioral, and psychological reasons why these populations are most at risk, which I will go into in the following slides. Children are more vulnerable to pollutants than adults due to their biology and the fact that they're still developing. They have increased vulnerability to air pollution because children breathe more air than adults and have less efficient nasal infiltration. Similarly, children drink more water than adults. Their growing organs are more easily harmed and they're exposed to more pollutants per pound of body weight than adults are. Finally, infants have a higher resting metabolic rate and higher oxygen consumption rate per unit of body weight than adults do. As people get older, they go through psychological changes such as weakening immune systems and more susceptibility to toxins or infections, which means more health risks from breathing in polluted air or drinking contaminated water. Elderly people typically take longer to recover from illnesses. Similarly, they take longer to recover from exposure to pollutants. Elderly people are also more vulnerable to chemical exposure because of a decreased capacity to repair DNA damage caused by mutagens. People with pre-existing health conditions, specifically diabetes, asthma, heart disease, and respiratory illnesses, face the challenge of a weakened body's immune system, which in turn makes them more susceptible to harmful health effects from environmental pollutants and increased harmful effects to their existing health conditions. Low-income and minority populations are more likely to live near polluting facilities, industrial zones, power plants, highways, and waste sites, causing air, soil, and water quality. This is due to a history of redlining and environmental racism. The most severe harms from climate change and pollution fall disproportionately upon underserved communities who are least able to prepare for and recover from heat waves, poor air quality, poor water quality, flooding, and other impacts. Analyses show that racial and ethnic minority communities are particularly vulnerable to the greatest impacts of climate change and pollution. This is known as environmental injustices. The main takeaway is that there is no safe public health without good planetary health, and there needs to be a greater focus on protecting the most vulnerable populations. I've learned a lot through this capstone project and see where gaps and priorities exist. I work for the Environmental Protection Agency in the branch of Children's Health, Environmental Justice, and Equity. We are making positive change every day, but there's still a long way to go. My goal moving forward is to focus on the most vulnerable populations in my work and advocate for this to continually be a top priority for the administration and in society as a whole, as well as listening to communities' voices and needs. Policy creation is essential to developing positive change. I plan to advocate for and prioritize the voices of marginalized residents and frontline communities who were left out of decisions in the past. In addition, environmental protections exist, but many of them lack specific knowledge for the most vulnerable populations. I plan to fill those gaps, but continue to develop solutions around where gaps exist. Our ability to sustain a just and safe world is dependent upon how we can avoid the mistakes of the past and develop positive change moving forward, with those most vulnerable as a top priority. Thank you.